Okay, so the last part of the vacuum suction routine is the back. We're following the lymph node direction again. So we're going to remove the first towel. We're going to tuck in the smaller one into our client's underwear and make sure that we've got as much of the back, access to as much of the back as possible, and we've already made sure that our client's underwear is protected so you don't get oil on their clothes. We're going to put our oil on. And once again, we're going to make sure that we have enough. We don't want to slip off the client's skin, but we certainly want to make sure that we've got enough to glide. When you've got enough oil on, you would do your 6 full effleurages, so it will be exactly the same as your body massage at the end of the routine. So you do your 6 full effleurages, that's preparing the area, and you know you would do the 6 at the end as well. Take the excess oil off of your hands. Now, because it is the back, I'm going to put the larger ventouse on. And I'm going to make sure I've got my 20% in the cup. On the back, it's difficult to get 20% if there's not a lot of tissue because of the bonier areas. So what we basically have here, the lower back, just from here downwards, are going to go to the lymph nodes that's in the groin. So they're going to come outwards. So they're going to be covered, and we're coming out to the side, stretching, overlap, out to the sides, overlap, out to the sides, out to the side, stretch as you go, out to the side, and try to keep that wire off your client's skin. And we'd do 5 to 7 of those. Now the lymph nodes for the upper back from here upwards are all going to come towards the armpits. So they're going to come up and out like a fan all the way around. Up the arm, all to the lymph nodes in the armpit. So from the side here, we're going to be covering the ventouse, the hole, so we've got suction and come up, release, come up and release, come towards the armpit and release, make sure you're stretching as you go, and make sure that you are overlapping your ventouse. If there's very bony areas, you do not put pressure on, you do not go over them. So from the shoulder, we're coming down, down, and then on the upper arms, we're going to be coming in. Now, if you need to change your ventouse to the smaller one for the upper arms, then you would do that. If you need to adjust the 20% in the cup for the upper arms, you would do that. So on the other side, you're doing exactly the same thing. So you would be coming towards the armpit, stretch as you go, and overlap. Stretch as you go and overlap. You come in a complete circle. And then you would do your upper arms. That would be the backs. You've done the fronts from the other side. When you've completed 5 to 8 of the lower back coming down, the upper back all coming in a fan towards the armpit area and then on the upper arm. When you've done 5 to 8 of those, You will take your ventouse off, secure it again very carefully in your lined bowl, turn your machine off, and you would always finish with your 6 full effleurage to calm and soothe the area down at the end of the treatment. Finishing position is the same as body massage, lower back and upper back. Then you would cover your client, help them turn over, give them a glass of water, and then talk about their aftercare advice, all the advice that they need to know to make the treatment as effective as possible. So that's going to cover everything we've already covered, to do with their lifestyle changes, any habits that they may have which you can enhance the treatment by them reducing or hopefully cutting out, like nicotine and alcohol and that sort of thing.